Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. And happy 4th of July, Independence Day. Today, I'm going to talk about one of the most serious global public health challenges of the 21st century, affecting kids across the United States and the globe. This week, July 4th to the 10th, is Childhood Obesity Week. I'll delve into the social determinants of health driving disparities in childhood obesity rates, and I'll discuss 5 things parents can do at home to keep kids healthy and safe. Let's get started. First off, what is childhood obesity? And why is it such a problem? Obesity occurs when a child is significantly over the ideal weight for his or her height. Just like adults, kids develop obesity when they consume more calories than they burn off. Obesity is a serious chronic illness that's also a major risk factor for other serious chronic medical problems such as high blood pressure, high cholesterol, diabetes, liver disease, cancer, and orthopedic issues. Obesity during childhood is also associated with lower self-esteem, increased risk of getting bullied, worsened school performance, and fewer employment prospects as an adult. Why is childhood obesity a population health problem, both in the US and in the world? In just 4 decades, the number of school-age children and adolescents with obesity increased over tenfold from 11 million to 124 million. That's 2016 data. An additional 216 million kids were considered overweight but not obese. In the US, about 20% of children and adolescents aged 2 to 19 are obese, with rates tripling since the 1970s. Of the 15 million children in the US diagnosed with obesity, Black and Hispanic children are disproportionately impacted, which adversely affects their physical and mental health, including poor self-esteem and increased rates of depression. So what causes obesity in children? Risk factors can be medical, genetic, behavioral, but in most cases, obesity boils down to unhealthy foods and sedentary habits. Specific reasons why more and more kids are becoming obese include, number 1, diet. Eating bigger portions and eating high calorie but nutrient poor foods like candy and sugary drinks. Number 2, sedentary lifestyle. Increased screen time, example, television, smartphones, iPads among children and teens is having harmful effects on weight. So instead of playing outside, many kids are indoors with video games and other devices. Number 3, psychological factors. Stress at home, school, and elsewhere can cause a child to overeat in order to cope with their emotions. Examples include childhood physical and sexual abuse, or parental arguments, fights, or divorce. Number 4, medications and illnesses. Some prescription drugs like steroids, lithium, and gabapentin, as well as certain illnesses, can increase the risk for obesity. Now, let's talk about the impact of social determinants of health on childhood weight. According to the CDC, the conditions in which we're born, live, work, play, learn, worship, and age are social determinants of health. Examples include safe and affordable housing and high quality education and healthcare. Research shows that disparities in these determinants contribute to persistent chronic disease among racial, ethnic, and socioeconomic groups. Children of lower socioeconomic status are almost twice more likely to experience obesity than children of higher socioeconomic status. Here are two specific issues driving these disparities. One is food deserts. Low-income communities don't have abundant resources to offer children a healthy upbringing. Research shows that healthy food is scarce in poor neighborhoods across the United States. The lack of fresh produce compels families to buy meals at convenience stores, gas stations, liquor stores, and fast food restaurants that sell foods high in fat, sugar, and salt. Lack of grocery stores carrying a diverse selection of healthy foods puts millions of low-income and minority children at the highest risk for obesity and other weight-related diseases. Number two, community and environmental factors. Studies show that racial and ethnic minorities and low-income families are more likely to live in neighborhoods with limited access to physical activity, such as parks, playgrounds, and other green spaces. These neighborhoods also have fewer street features that encourage walking or running, such as sidewalks, street lights, marked crosswalks, or bike trails. All of these factors create disparities in access to health and well-being and can increase the risk of obesity among children of minoritized groups. So here are 5 things parents can do to prevent childhood obesity. Number 1, move more. Dance, bike, walk the dog, or jump rope. Number 2, cut down on sugar. Replace sugary drinks like juice drinks, soft drinks, and flavored milk with water, 100% juice, or plain low-fat milk. Read nutrition labels. One Tropicana 8-ounce orange juice contains 21 grams of sugar. Number 3, eat the rainbow. Make half the plate colorful fruits and vegetables. Number 4, sleep. Good sleep can prevent obesity, diabetes, and mental health problems. Remember, kids age 6 to 12 need 9 to 12 hours of sleep, and teens age 13 to 18 need 8 to 10 hours of sleep every night. Number 5, reduce screen time. Keep mealtime device-free, turn screens off an hour before bedtime, and many more. Create your personalized family media plan through the American Academy of Pediatrics. So, how can you get involved? You can donate to and learn more from charities that are dedicated to solving social determinants of health. Fight Childhood Obesity focuses on delivering healthy foods locally to children living in food deserts. Bikes for Kids, City Park Foundation, and Kaboom are great organizations that work to make communities safer and more diverse for children seeking areas for activity. Well, that's all for today. Here's your joke of the day, July 4th theme. What do the US flag and a sad candy cane have in common? They're both red, white, and blue. I'll see you this Wednesday, 3 p.m. Eastern. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health, Humor, Harmony, Dr. Roy. Be well. I'll see you soon.